Well, this month is Prostate Cancer Awareness Month, and just this year, the American Cancer Society expects more than 300,000 cases of the cancer to be diagnosed. And so that's why today we're talking with Allina Health oncologist Dr. Bajanath Kennedy to talk about everything men need to know to protect themselves, just to make us smarter a little bit.
Sure.
All right, so let's talk about what prostate cancer is and how common it really is.
The prostate is an organ that's right below the bladder, and it actually produces some enzymes that help with sperm vitality and so forth. But as men grow older, they have a tendency to and have a high risk for developing prostate cancer. So it's a disease of aging. That doesn't mean young men can't get it, but it tends to be the older people who are more likely to get prostate cancer. It's the second most common cancer in men after skin cancer. So it's very, very prevalent. And at about age 80, about a third of men will have prostate cancer. Prostate cancer tends to occur in between 1 in 6 to 1 in 8 men. The good news, though, is most of them will not die of the prostate cancer. So that's the good part about prostate cancer. It's a very slow-growing disease, and if caught in time, it can be treated well.
Slow growing. Okay, so if it's slow growing and maybe you can't detect it super early, when would be the best time to get tested then?
So that's a great question. So you can screen for prostate cancer, and the test is very simple. You do a blood test called prostate-specific antigen, or PSA blood test, and there are different guidelines, but the American Urologic Association guideline, which I have helped be part of a committee of, that has developed those guidelines, they recommend that you start screening at age 50 up to age 69. But you can also get one single PSA at age 45, and if that's very high, then you probably want to start screening between ages 45 and 50 as well. In men who are at high risk for prostate cancer, that is African American men, men with a family history of prostate cancer, or certain specific gene mutations like BRCA2, we recommend starting screening a little bit earlier, even as young as age 40. And the screening is getting the blood test and an exam of the prostate with the finger every couple of years at least. And you keep following it, and if it becomes abnormal, then that leads to a biopsy and further diagnosis.
Okay, with how common it is, how you were talking, it may be good to do that earlier test if possible.
It is, but we have to be thoughtful about it, because the concern is if you do too much screening and find all these prostate cancers that are really not going to be harmful or lethal, then that may lead to overtreatment. So that's why there's a lot of discussion that needs to occur between the patient and the doctor, and the patient needs to understand all the ramifications of what's involved in the diagnosis, what's the risk of treatment, and then proceed with the screening.
Okay.
It's called shared decision making, and that's what we recommend.
Yes. Before I do let you go, if you do get that positive result, what does treatment look like?
So that's also been changing, and prostate cancer is divided into low risk, medium risk, and high risk disease, just broadly speaking. So if you have low risk disease, oftentimes, even in young people, we'll just watch it and very carefully observe them, and if things change, we'll act on it at that time. For medium and high risk disease, the ideal treatments are surgery to take it out, usually done with a robot, or radiation therapy, which is delivering X-rays, high intensity X-rays to the prostate. The more emerging treatment is called focal therapy, where we can use different types of energy to just focally treat and kill parts of the prostate tissue. So that just destroys the cancer but leaves the whole prostate intact.
Okay, so there are options.
Many, many options, yeah.
All right, thank you for educating us, doctor. We'll have more on all of these details at KARE11.com/noon. We'll be right back.